Preterm labor is defined as labor that begins before 37 weeks of pregnancy. You are at highest risk of preterm labor if you had preterm labor and birth in the past. You are pregnant with more than one baby, such as twins or triplets, or have physical or psychological stress. Your water breaks before 37 weeks of pregnancy. You have an ultrasound that shows your cervix is short. You have a problem called placental abruption. This is when the placenta separates from the uterus and causes vaginal bleeding. Other things that might increase the risk of preterm labor are using illegal drugs, such as cocaine, smoking, excessive amniotic fluid, infections, being underweight, vaginal bleeding during the early part of pregnancy, waiting only a short time between pregnancies, previous surgery on the cervix, an abnormally shaped uterus. The symptoms of preterm labor are the same as with normal labor. Tightening of the uterus, also called contractions, these can make your belly feel hard while they are happening. They eventually become painful. A change in the fluid that comes out of your vagina, it might be watery, thick, or bloody. Pain or pressure low in your belly or in your thighs, low back pain, belly cramps, sometimes with diarrhea. Broken water, which can feel like just a trickle or a big gush of fluid from your vagina. Some people have something called Braxton Hicks contractions that can happen several minutes apart. They are usually not too painful and don't get stronger or more frequent over time. They often go away when you lie down or rest. Braxton Hicks contractions are sometimes called false labor contractions. If you think you might be in labor, call your doctor. You should also call if you have blood or fluid leaking from your vagina, or if you have more than 6 contractions in 1 hour, or if contractions are 10 minutes apart.
Thank you for listening. Subscribe to Diseases Simplified for more health tips and updates.